Skinner is here presenting SB 59, having to do with menstrual products.
Thank you so much, Madam Chair and members. Pleased to present SB 59. A lot of us in this room have a period story, and one that, I won't recount mine because I'm still embarrassed about it. And of course, the first ones happened when I was pretty young, but they didn't stop just then. They went on. And why? Because either I was not prepared, I didn't know that I was going to get my period that particular day, or my flow is heavier, any number of reasons. So we go into bathrooms, and of course there's toilet paper. Everybody expects it. That's part of the sanitary, provisions that we provide. Well, period products should be the same. And California has been incredible. We are now providing such products at our schools, at a variety of other places. We've ended the tax, but in our government buildings, they're not assured to be here. And so what SB 59 does is expands the accessibility to menstrual products by ensuring that the restrooms in state buildings and state-funded public spaces provide those products. And with that, I want to have my witnesses in support speak, and I have Tiffany Witten from SEIU and Katie Van Denez from Health Access.
Thank you very much. First witness, please go ahead. Welcome.
Thank you. Good afternoon, Madam Chair and Senators. I'm Katie Van Dynes, a policy and legislative advocate with Health Access California, the statewide healthcare consumer advocacy coalition, and we're proud to support SB 59. SB 59 will make menstrual products more accessible by requiring free period products in bathrooms in state-owned and state-leased buildings and local government and hospitals that are funded by that have state funding. This will create inclusive spaces in public buildings where all menstruating people will have equitable access to these products. SB 59 both removes the financial barrier to accessing these products in these buildings and ensures that if someone doesn't have a product, there's one available for free. While period products are essential products for menstruating people, not everyone can access them due to the cost. A 2022 study found that 2/3 of low-income women could not afford menstrual products in the last year. And half of those reporting had to choose between a menstruating product and food. Lack of access to menstrual products has serious consequences for people's ability to fully participate in their daily activities, their physical health, and their emotional well-being. And these consequences disproportionately impact low-income people. Not having access to period products can mean that menstruating people have to improvise with a paper towel or something else, or even use a period product longer than advised, which can have serious health consequences. If people use tampons longer than advised, this can lead to toxic shock syndrome, which can lead to fever, shock, low blood pressure, skin rashes, liver and kidney abnormalities, and this can be fatal. If someone has to improvise and use a rag, paper towels, or reuse a menstrual product, this can increase risk for infection. SB 59 is an important bill to address menstrual inequity and ensure that when menstruating people go into these spaces, they have access and know that they have them free of charge. I respectfully ask for your aye vote on SB 59. Thank you.
Thank you very much. Next person, please.
Thank you, Chair Eggman, members of the committee. Tiffany Whiten with SEIU California, representing members of the workforces of California safety net programs and many workers at our public hospitals. Our workers are there when people need help. Rain or shine, pandemic or recession aside, they are there to create a more healthier and equitable California. SEIU is committed to protecting our safety net and carrying out mandates that are placed on our public sector employees and protecting and advancing public health improvements. And the significant majority of these workers are women of color. In fact, 7 out of 10 SEIU members identify as women and 60% as women of color. SEIU continues to stay committed to gender equity in the workplace and, like this bill, acknowledges that not all menstruating persons identify as women. Transgender men, non-binary, and our gender non-conforming workforce may also menstruate and experience inequities resulting from lack of access to menstrual products. And too many of our menstruating workforce are not more than a paycheck or two away from being on the other side of the line. We support SB 59 and thank the author for bringing this bill forward. SB 59 will not only ensure improved dignity and health for Californians our members are so proud to serve, but also because it will bring equity to our members of our workforce who menstruate. Here in the Capitol, thanks to the leadership of Pro Tem Atkins and the janitorial professionals, Capitol staff have access to free period products. That is great. It should be the standard and every state worker and every worker who is employed to provide services under a state-funded program. It was the labor movement which led the fight for the right to a bathroom at work. This is a continuation of that fight, a fight for an equitable bathroom at work where everyone is ensured all the free sanitary products they need. For these reasons, we are proud to support SB 59 and urge your aye vote. Thank you so much.
Thank you very much. Now would be the time for other people in support, just to come to the microphone, your name, organization, and support.
Ryan Spencer on behalf of the American College of OBGYNs, District 9, in support.
Thank you. Okay. Seeing nobody else coming forward, we would take any people speaking in opposition today.
Committee members, my name is Sophia Lorey and I'm with California Family Council. At first glance, SB 59 appears to be a positive bill. How can anyone be against providing menstrual products in women's restrooms? Yet, this bill also requires state-owned buildings to provide menstrual products in male restrooms, pushing the lie that men can have a menstrual cycle and erasing the truth of what a woman is. This bill disregards the inherent dignity of women by attempting to obscure obvious biological distinctions between males and females. Let's walk through basic biology. Only females have to endure monthly menstruation where the lining of the uterus sheds, causing blood to flow from their uterus through their cervix and out of their vagina. Does a man have a uterus? No. Does a man have a cervix? No. Does a man have a vagina? No. Thus, males do not have a menstrual cycle. Let me repeat that. Males do not and cannot have a menstrual cycle. Your bill makes a mockery of this reality. The author claims to be standing up for women, yet SB 59 erases women when it pretends our biology has nothing to do with our identity. This committee is made up of 9 female members. Think of the hard-fought battles women endured for the right to vote, to own property, to run for office, and to be treated legally as equal to men. We went from fighting for women's rights to now fighting for men's rights to feminine products. You are being asked to affirm the idea that anyone can be a woman. Is that the legacy you want to leave your daughters and granddaughters? If you really want to be pro-women, ask that this bill be amended to remove the requirement that men's bathrooms need feminine products too. I urge a no vote on SB 59. Thank you.
Thank you very much. Anyone else speaking in opposition to this bill today? Seeing no other lead witnesses, would anyone like to come forward? Seeing none, we'll go to the phone lines now. Oh, please.
Greg Burr with the California Family Council in opposition. Thank you.
Brandon Campbell, Northern California Director of the Capital Connection for Independent Baptist Churches in opposition.
Christine Campbell in opposition.
All right, seeing no more line, we'll once again go to the phone lines. Anybody wishing to speak in support or opposition, now would be the time just to give your name, organization, and position. Moderator, can you please open the phone lines?
Thank you. If you wish to make a comment on SB 59, please press 1, then 0 at this time. We'll go to line 67. Please go ahead.
Chair and members, Ms. Shelteran Wolfork with the California Commission on the Status of Women and Girls in strong support. Thank you.
Thank you. Next caller, please.
Thank you. Line 72, please go ahead.
Andrea Rivera on behalf of the California Pan-Ethnic Health Network in support.
Thank you. Next caller, please.
Thank you. Line 53, please go ahead.
Michelle Connor, Concerned Women for America, strong opposition to this bill. Thank you.
Thank you very much. Next caller, please.
Thank you. Line 75, please go ahead.
Hi, my name is Christina McKinney. I'm a person in strong opposition to this bill.
Thank you very much. Next caller, please.
Thank you. Line 70, please go ahead.
Hi, this is Kelly McMillan, and I'm calling on behalf of Parity for Pumps in support. Thank you.
Thank you. Next caller, please.
Thank you. Line 63, please go ahead.
Hi, my name is Sarah Kim, representing TV Next, and on behalf of thousands of followers of TV Next, I am in strong opposition of SB 59. Thank you.
Thank you very much. Next caller, please.
Thank you. Line 57, please go ahead.
Yes, good afternoon. Matthew McReynolds, Deputy Chief Counsel of the Pacific Justice Institute, Center for Public Policy, in respectful opposition.
Thank you very much. Next caller, please.
Thank you. Line 49, please go ahead.
Hi, I'm Young-Soo Hwang. I live in LA County. I strongly oppose this bill. Thank you.
Thank you very much. Next caller, please.
Thank you. Line 80, please go ahead.
Hi, my name is Yadira De Leon from San Bernardino County, and I am in strong opposition of SB 59.
Thank you very much. Next caller, please.
Thank you. Line 77, please go ahead.
Sylvia Hernandez with the National Association of Social Workers, California chapter, and we support this bill.
Thank you. Next caller, please.
Thank you. Line 82, please go ahead.
Penny Harrington from San Diego County, oppose unless amended.
Thank you very much. Next caller, please.
Thank you. I have no further comments. Thank you.
Thank you very much. Having exhausted all the comments, it is now time to come back to members. Senator Wiener.
Thank you very much, Madam Chair. I want to thank the author for bringing this forward and all the supporters. It's a really important bill, and I'm happy to move the bill. I do just want to note, with respect to some of the anti-LGBTQ hate groups who testified today, and that's what they are. Let's just be clear, and especially with the one anti-LGBTQ hate group that that is now, I guess, portraying itself as having somehow fought for women's equality. I want to be clear that these same homophobic, transphobic organizations opposing this bill today also oppose equality for women. How many of them are trying to get the ERA put into the Constitution? They're fighting against women's reproductive health. So this whole notion that somehow it's pro-women to be anti-trans is absurd, and I want to thank the author and all of the supporters and sponsors for acknowledging that. Happy to move the bill.
Thank you very much. I do not believe we have a quorum yet, but noted. Senator Wahab.
Thank you. I also second the comments of Senator Wiener, and again, thank you, Senator Skinner, for bringing this forward. I think that one of the things that we can all talk about is that we have to lead by example, and this bill does that, number one. And number two, at the same time, that as much as people don't want to admit, there are realities there that we have to provide for everybody. And I think that this really does help move that forward. When we talk about women's rights and women's issues, this bill exemplifies that. So again, I just really want to thank you for your leadership. I want to thank all the supporters for this, and I'm very excited to support this. Thank you.
Thank you very much. Senator Hurtado.
Thank you, Madam Chair. I just hearing the opposition testimony today. Part of my concern coming into this hearing and in regards to this bill, really was the hate and misinformation that comes out of some folks, some groups, and I really think about individuals that. I'm worried. I'm worried about people being harmed. And so I'm happy to support the bill today, but I want us to really recognize that there is fear, there is hate out there, there is a lot of misinformation, and I think that we also need to work towards making sure that that there is, if there's any way kind of prevent any harm for individuals, that we do that as well. Thank you.
Thank you. Senator Rubio.
Thank you, Madam Chair, and I also want to commend the author. I am a proud co-author to your bill, and so I'm really glad that we're providing access for those that don't have access, and it makes me sad when we do hear misinformation and what comes across as uncollaborative and just hateful. So I hope that we move this forward and we could all agree that having these in restrooms as women is important. So thank you. Thank you, Madam Chair.
Thank you very much. Senator Skinner, I'd also like to say there was a women and girls group that took place in Stockton. I was there with former Assemblymember Christina Garcia when we first heard the young girls coming before us, and that kind of started some of the menstrual equity work that was done around that. Young girls coming forward and just talking about being in foster care and being in different places and not being able to go to school and using socks and newspapers and all kinds of things like that. And I am also, to echo Senator Wahab, glad that we're doing it ourselves. Oftentimes the state exempts ourselves in public buildings, and so this includes everybody. And I would also say, as somebody who's also, of course, has period issues like anybody else, previously, and also is somewhat gender fluid, going into a restroom can be a traumatic experience for people. I have, so and I don't think it helps any of us. And for those who come from a more spiritual place, I don't think it furthers your movement any to be dismissive of any of God's children. So we will wait until we have a quorum, but would you like to close?
Thank you so much. And I really appreciate my colleagues' comments, and I appreciate the acknowledgement that tragically the main group that spoke in opposition, it is motivated by a terrible bias and hatred towards our trans population. But when they spoke, so much more came to my mind. Obviously, we have the issue of the rights of our trans brothers and sisters. However, we also have anyone who has talked to medical professionals know that there is great variation in biology, and there are people that have ambiguous genitalia and are equipped with a variety of organs that we don't consider would be quote unquote in a normal woman or the normal man, and yet these are people, they are normal. They are normal. But additionally, what occurred to me is my own daughter's, one of her best friends in middle school and high school, and I'll use a different name, just Miriam, she looked like a boy. She was not a trans person. She still looks like a boy. She would go to the female restroom and be told, "You don't belong here, get out of here." So very often, to avoid that, she would use the boys' room. Now, why should she not be able to get the product that she needs? The other thing that occurred to me is that in some of our older buildings, I think every one of us women know, whenever there's a big event and there's a huge crowd and then there's the break and you all have to go to the bathroom, there's lines at the women's room and the men's room is empty. So we use it. So this artificial distinction with bathrooms makes no sense. We supply toilet paper, we should supply period products, and this is equity, period. Thank you. I ask for your aye vote.
Thank you very much. And when we have a quorum, we already have a motion, and we'll take a vote on that. Thank you very much, Senator Skinner.